Hello everyone. Again, I'm just quickly giving you a small healthy talk on autistic spectrum disorder. And now I'm going today in this third session, as I previously discussed in the previous session, that's the most important diagnostic point is social communication difficulties. Also some restrictive, repetitive behavior, early onset, usually of the signs usually comes very early in life. So today I am going to tell you this third session is about pre-diagnostic support, a guide for parents and carer. So if you think your child is autistic, getting a diagnosis and better understanding of their need can be a very positive thing. So screening tests are available, but should not be alternative for proper. You need a healthcare professionals to help you in the diagnosis. So basically, it is very thing that is it is a guide to help you to how child can be referred for autism diagnosis. So first of all, is it autism? That can be the question, and because the sign varies from a person to a person, but for a diagnosis to be made, a person will usually be assessed as having had persistent difficulties in social communication, social interaction, restrictive and repetitive patterns of behavior, activities and interest. These difficulties will have been persistent since childhood and will have affected and limited their everyday life. That is the most important thing that carers, parents and carers has to remember. Child can be diagnosed as autistic when they are quite young. In some cases, from the age of 2, but not everyone is diagnosed early in life. It is quite common for a child to not get their diagnosis until they are older or even an adult, particularly if they don't have accompanying learning disability. Some of the main signs that you have to know that I'm just repeating for your knowledge. So you can see that not drawing their parents or other attention to objects or event. For example, not pointing at a toy or a book or something that is happening nearby. Or a child may eventually do this, but it will be later than expected. Carrying out activities in a repetitive way, like always playing the same game, same way, lining the toys up a particular order, resistance to change or doing things differently, emerging difficulties in social communication, interaction, behavior such as biting, pinching, kicking, pika, means putting in edible object in the mouth, or self-injurious behavior. So all these things you have to keep an eye. So for getting a referral, you may have a reservation about pursuing a diagnosis for your child. This is your personal choice. But often a diagnosis can bring a sense of relief and help both you and school how to help your child, how to better understand your child need. It can also help your child by enabling them to identify their autistic peers. If you are unsure about pursuing a diagnosis, it can still be a good idea to ask for a referral, as you may have a long time to wait for an appointment. So this will mean that you are not delaying the process while allowing yourself time to give more thought. You have to speak to your GP or health visitor. That is a good thing that you can speak about it with your GP. We'll take along a list of behavior and characteristics that make you think maybe your child is autistic. It can be useful to keep a behavior diary leading to any appointment before the referral. GP has a particular, for preschool age screening interview called MCHAT, Modified Checklist for Autism in Toddler. This will not give you a diagnosis, but this is a way that indicating whether your child may be autistic. Other tools are also there. There is some Smart 4 app, but I don't think any of them is good as, assessment, proper assessment by professional and giving a diagnosis. If you have a school-age child, useful to make an appointment with SENCO, means School Special Educational Need Coordinator, or learning support teacher to discuss your concern. Teaching staff may have also identified similar behavior and characteristic, and you can mention to the GP or in your child's diagnostic assessment. And then referral for the diagnosis, GP or health visitor, if they're convinced that have difficulties, they will refer for a formal assessment. So basically, in the meantime, your child could be referred to other teams such as speech language team, occupational therapy, educational support service. So this professional, they might help your child's understanding of child's need. The child should have a multidisciplinary diagnostic assessment by teams of professionals. There are pediatrician, speech language therapists, specialist psychologists, all will be there to diagnose. Okay, so these are the things like that. There is of course private assessment you can ask for, but this is the way NHS, that way it usually helps to make a diagnosis, refer a diagnosis to help the child if they have this any of the sign of autistic spectrum disorder. Hope this is a little help, and we will carry on this help procedure in the next session also. Thank you for listening me. Have a good day.